Hi, welcome to episode 115 of Concussion Talk Podcast. I'm Nick Mercer, and I'm here with Tracy Lin, and she was a physiotherapist at Mount Sinai Rehab in New York City. Works with Corey Lewis, who I had on a few weeks ago. But she will actually talk about CranioSacral Therapy, which I will learn a lot more about then too. But first, I want to pause for a word from my sponsor, HeadCheck Health. Concussion Talk Podcast is presented by HeadCheck Health. HeadCheck Health bridges the gaps in concussion care through simple, powerful technology. Join organizations like the Canadian Football League, Track Factory Racing, the Canadian Junior Hockey League, Eastern Washington University, and Volleyball Canada, who rely on HeadCheck Health to improve communication and optimize care. Visit headcheckhealth.com for more. And also, I'd like to just remind everybody that my new fangled website, newly designed website, is up. Thanks to John Devereaux from Perfect Day and Pod Pages. So please visit me at www.concussiontalk.com. Follow me on social media at Concussion Talk, Instagram, Facebook, Twitter, and Patreon. Good Concussion Talk. Patreon.com/concussion talk. And what else? And subscribe, rate, and review on my podcast, wherever you can tell mail on at concussiontalk.com. So one-stop shop. Perfect. All right. So now we'll start with talking to Tracy. Thank you, Tracy, for running through all that. And so I know Tracy and I talked briefly last week, and I know she's from England and moved to New Jersey, and she does a whole spiel about that. So I'll let her, Tracy, introduce yourself, and then she can talk about why did you come to, or why were you work in New York City, and why did you move to New York?
Well, thank you, Nick, for having me here. I was born and bred in England, in Kent, actually, and I tell a joke how I moved from Kent, which is the Garden of England, to the Garden State, because I moved to New Jersey. And so I moved here when I was in high school. So I've been here quite some time now. So this is like my...
We won't go to that. For a while.
Yeah.
And then you took up, you started, you did out of university in physio, and you started working at Mount Sinai Rehab. And what do you do? What is your interest in physio, and then also how'd you get involved with Mount Sinai Rehab?
Yeah, so when I graduated Northeastern, in 1992, I actually worked at Kessler Institute for Rehab in New Jersey. I started there working with in the inpatient unit with spinal cord, amputees, stroke patients, and brain injury.
Yeah, I was actually inpatient rehab in St. John's, so not nowhere near New Jersey. Well, not nowhere near, same coast.
Yeah,
you've seen the
yeah, and then I moved to New York, and that's how I came from Mount Sinai.
Right, and
so I've been at Mount Sinai now since 1998. So I work at the outpatient department there as an advanced.
You work with Corey?
Yes, I work with Corey. Yes.
How many physios are you there at the outpatient clinic?
How many physios? I want to say around 12 to 14, because some are full-time and some are part-time. I don't actually see some of the part-time, just because I am a part-timer, so I work Monday, Wednesdays. So I don't really get to see a lot of the others. So it's quite a big department. We're OTs and PTs together.
Wow.
Base.
Nice. So, and you started, when did you start realizing that maybe there's something else that could help your brain, your stroke, concussion patients, more than simply you're not simply, but you're just your physio? There's something interesting there.
But my craniosacral therapy?
Yeah.
What I do?
Trying to
So
slide in there. under the
Do you like
radar.
that?
Yeah.
Yeah, I actually, so I've been doing, practicing craniosacral therapy since 2015. And so I came upon it because I'm certified in McKenzie, which is the
Right.
the approach of the mechanical diagnostic therapy with the spine. And so I actually
so what is the McKenzie approach?
So it's really just a way to evaluate spinal problems,
Okay.
so the McKenzie approach. So it's very systematically, back pain, neck pain, thoracic pain, and now they do it extremities. So it's a way to kind of evaluate and treat. So I got my certification there.
Okay.
And so I was specializing in the spine when I got hired at Mount Sinai.
Yeah.
And so and over the years, I realized, and I was seeing a lot of patients that would have L5-S1 issues. And, and through the McKenzie approach, it was actually very successful, but yet they were still having a little bit of pain, like something that was just nagging them. They would get injections from the doctors and it still wouldn't be enough to take it away. So, and that got me thinking after a while, like, what else could I do? So that's when I came upon Upledger's CranioSacral Therapy, and I took CS1, and I loved it because it's really completely different from what I have taken before as a physical therapist, and it really is a whole body approach, and you can work with So, because I thought, sacrum, right? You're working with the sacrum, maybe some influence with your low back, but really it has influences all different systems in your body.
So maybe you should just explain to everybody what the Upledger Institute is and what this approach is.
Yeah, of course. Yeah, and what is craniosacral therapy?
Yeah.
So I mean, I had my training through the Upledger Institute, but I know that there's different types of craniosacral therapies. There's biodynamic biodynamics craniosacral therapy. It's just a different approach, slightly different. So I'll talk about my training as Upledger trained. But what craniosacral therapy is, it's really a gentle hands-on method of evaluating and enhancing the functioning of the craniosacral system. And that's a physiological body system in our bodies. So what is the craniosacral system?
That's my next question, yeah.
Yeah, and so it consists of the membranes and the craniosacral fluid that surrounds and protects the brain and the spinal cord.
And so cerebrospinal fluid.
Yes, that's correct. Yeah. And so as a practitioner, I would be helping to release restrictions within the craniosacral system. And so that will help optimize its function. So, since then what is the function of the craniosacral system, right? So the question leads. So Upledger describes the craniosacral system as a semi-closed hydraulic system. So what that means is that if you think about, and I'll be very brief because there's a lot of intricate details, but in a nutshell,
nothing but time.
So in a nutshell is so you have three membranes surrounding the brain, right? You have the pia mater, arachnoid, and the dura. And so within the layers of the arachnoid and dura, there's the cerebral spinal fluid, and it kind of comes around the brain and it kind of exits the skull and goes around the spinal cord. And it acts like a system, hydraulic system. Okay. And so what happens is that it also helps there's an emptying and a filling of the craniosacral fluid, cerebrospinal fluid. So it empties out waste and then it brings on nutrients. So it empties waste brings in nutrients. So what happens is there's a type of
kind of
filling.
like the pipes in your house, you mean?
Sorry?
Kind of like the pipes in your house. They bring in the water and they get rid of the waste, but obviously they're not dissolved one
Kind
system.
of, yeah, but and it's semi-closed, so it's kind of like continuous. And so what happens is that so this emptying and filling movement, and it's a rhythm. So that creates this craniosacral rhythm.
Okay.
And that's where I can, as a practitioner, can feel the rhythm anywhere in the body.
Oh, yeah.
So then I'm evaluating 4 things. I'm evaluating the symmetry, the quality, the amplitude, and the rate of the rhythm. So
what does that tell you?
So that tells me this. So if I'm, for example, I could be at someone's feet and I could be assessing their rhythm. And if I feel like, and when I'm at any extremities, right, the arms or legs, what the rhythm feels like to me is kind of an external rotation and an internal rotation. It's kind of like this opening and then kind of narrowing.
Okay.
And so that's what it feels like in my hands, but it's very, very small and very subtle. Yeah. And if I feel like there's an asymmetry, say the right or left, I'm just noting it. I'm noting there's some restriction going on, maybe somewhere on the lower extremities part, because it's kind of a fascial matrix too, right?
Okay.
So then I may go to they have listening stations. I may go to the pelvis and then feel that. I feel for the symmetry, quality, amplitude, rate. And so the amplitude could be very small, meaning there could be a widening here on this side, but maybe not so wide on the other side, right? And the rate could be quick. So the rate is usually like 6 seconds back and forth. So it's like a 12-second cycle. Okay. So that's the regular rate. But then a rhythm can be quite quick. It can be very super slow. And so we're kind of assessing throughout the body where there is restrictions, and that's how we actually evaluate. And then once we kind of release some tissue tension or during treatment, then we go ahead and reassess the rhythm. So we're always allowing and listening to the rhythm.
Okay, so if the rhythm is speeded up in one part of the pelvis or the feet or whatever, yeah, does that mean there's tightening on that side? If you feel the rhythm is increased on the right side, does that mean there's a problem on the right side? Okay. Possibly,
yeah, possibly, and that's why we could. And there's another evaluative tool that we use called arcing, and that's kind of a little bit more. That's like CS2. There's a lot of different ways to evaluate. So if, for example, there's a decreased rhythm on the right, and then I find that but there's also decreased amplitude on the left upper thorax. Do you know what I mean? So I have to decide which one's more primary.
What does it mean if the amplitude is increased as opposed to?
So like if if I'm listening and feeling for asymmetry, it could be asymmetric in terms of its
the pressure basically.
Amplitude, yeah, and in terms of the movement.
Yeah.
That it's widening.
What does it mean though? What does that mean? Does it mean
it's just an asymmetry, yeah.
Okay.
We don't so I don't know, and I don't diagnose. I'm just feeling for what the body is telling me.
Right.
Do you know what I mean? So the key thing with cranial work is that we don't treat per se diagnoses, we treat symptoms. Yeah.
Okay.
So someone, because like, for example, concussion, you can have different symptoms and you have a concussion. I can treat concussion, but I'm really treating the symptoms of the concussion.
Right.
So like someone could have headaches, they could have dizziness, or, they've got anxiety, but also those are also symptoms of someone who maybe had a car accident,
Right.
or fall or something. So, yeah, so it's really fascinating because, and I tell my patients every time I see them, is that your body will present differently each time I see you. So just because I'm feeling restrictions over here does not mean that the next time I see you, I'm hoping that that would have been released, and maybe that will reveal another restriction somewhere else.
Oh, so you're constantly evaluating and
yeah, so you're bringing the craniosacral system into balance and homeostasis. So that's what you're really doing, because you're optimizing really the nervous system.
right.
So that's what it is. Yeah. So because you're working with the nervous system, you have direct relationships with other systems in the body too.
Okay.
Which is why it's so such a whole body approach, because I have many times, if I'm working with someone, say they're coming with neck pain, so I'm working on the neck, and I'm working on, maybe I'm working on the upper body, head, shoulders, whatever it is, but then I'll come back and I say, you know what, funny thing is that I feel like they would suffer from gut issues, and I say, you know what, I'm feeling that my gut is feeling better, or something unrelated that they came in for. That's and they may come back with that type of observation.
So who do you do? Every one of your patients you see, do they receive CranioSacral therapy, or do you pick certain patients that maybe could do with the?
Yeah, I mean, since I am in a hospital setting, I do have to treat them in terms of physical therapy, but I do try to, if they are appropriate and I feel that they may benefit from it, I will do cranial work with them. But it is difficult because we only have half an hour to see someone, and it actually is a process, So, but I do love it, and I do try, and I think you can get a lot done in 30 minutes.
Yeah.
And it's really I'm also a certified yoga instructor, and I do a lot of mind-body practices. So I do a lot of breath work, a lot of just bringing that parasympathetic nervous system down, a lot of imagery, a lot of kind of mind-body scanning and things like that, because when I have a patient on a table, and it's actually very relaxing to them, you're really not doing anything. And so as a patient, and so they may fall asleep. One of the benefits, like it actually really allows your system and your body to really relax and decompress. And that's a good thing, because that means that there's a lot more fluid kind of getting pumped around, and it just nourishes the brain, and just really it's a great way to kind of bring down the anxiety and like that tension that they feel.
Right. Yeah. No, actually, I kind of got the impression from those two. You sent me 2 videos of the Ricky Williams Foundation about his work at Upledger Institute in Miami. So are you in one in Miami?
Sorry?
Is there more than one, or just one in Miami? Miami or somewhere?
Yeah, there was, I think both the videos I sent you, they were they were in Miami, because Ricky Williams is the one that's really starting the foundation. But it's a really good video, kind of having you see how much
all the football players came in and
and how, even though it was they had chronic symptoms, they found a lot of change within themselves, and how physically, their gait changed, musculoskeletal, their mood changed, right? And so it's really, it's very uplifting, Yeah,
and actually, because you sent me a commentary by Dr. Eric Liskowitz. I don't know if I'm pronouncing the name at all correctly, but it looks right. So yeah, he was saying that that there's definitely some not maybe need or some benefit from craniosacral therapy in say CT, brain injury, maybe concussion, maybe long-term brain injury patients, especially in the NFL is where he got most of his data from, seemed to be.
Yeah. Yeah, and I think from his article and his commentary, he was just saying that there just needs to be a little bit more research about it, right? Because there's definitely see the benefits, but I'm sure like the medical community research, they want, it just more research needs to be done, but there's definitely benefits, so yeah. And I know that the Upledger Institute, they did some of the therapists there, they actually did a study. Let me see if I can find it. Yeah, so they did a study in the Medical Acupuncture Journal in 2017, where they treated like military service members, veterans, and some athletes, right, with craniosacral therapy and visceral manipulation, just to bring to attention of how this could be like an alternate treatment intervention for these folks.
There's there's so much study and so much in the brain. There's also so little we know about it that who knows what not who shouldn't say it like that, but there's many therapies that could work that we just need to give some more chance to. And you are a physiotherapist by training, and so do you see many concussed or brain injury patients in your outpatient therapy clinic on a daily basis? Or
so with my co-worker Corey, who you interviewed the other day, so we have with some other practitioners starting a concussion program at Mount Sinai.
And so some concussion program there,
so it's in the works, and seeing some concussion patients. And what I wanted to bring to the table was craniosacral therapy to the concussion program, because I feel it's just a really nice treatment approach and adjunct to encompass their whole, treatment, because it is multidisciplinary. And I feel that, especially with the patients I'm seeing right now, you have your musculoskeletal issues, they have the neck pain, they have headaches, but they also have a lot of anxiety, and so how do you bring those anxiety down? How can you do visual motor testing, ocular motor testings, if they are too symptomatic and they're too anxious?
Heightened under.
So we need to bring that nervous system down a bit, so that they can be in a place where their body is not on that activated mode, so that alarm system isn't like on high. And so that's where craniosacral therapy comes in. You can help balance that nervous system, and so you're doing that, but also you could be optimizing other systems to help. So maybe to help, with their overall mobility, and an outlook, so that maybe they can go ahead and now do vision therapy. They can get on the treadmill to do the testing,
Right. No, because those videos you sent me, I don't know, it was Dr. Upledger or Mr. Brian Upledger, what his name was, but
John Upledger.
John, I don't know why I put Brian, but anyway. But John Upledger said that it's not like a placement for physical therapy or for physio or for whatever, for any sort of treatment, but it's just an adjunct to, as you're saying, the adjunct to any of their treatment they may benefit.
They have, it's not replacing anything. It's just an adjunct, and it could be a really nice tool to really just help kind of facilitate someone's health and just their healing, really, so I do feel that you know, my passion is really to kind of keep working on my patients who have no idea what I'm doing, but they feel great. You know, they feel, I don't know, they can't explain it, but I'll give you an example. So I have many patients who will come to me. A lot of my colleagues will, at the hospital, will give me patients who maybe with traditional therapy just has not helped, right?
Okay.
And so they feel, you know what, Tracy, can you just do some CranioSacral? I think they may, because sometimes there's an emotional component to their healing, right? And so there is a component in CranioSacral where
can you tell if that patient is mostly emotionally needs some, like, maybe their emotion is bigger part of their injury, their treatment than
well, you know, sometimes you hear those patients where they're so stressed, you know, like my back pain is worse when I'm stressed, you know, or you know what, you know, and when I was on vacation, I had no back pain, but when I get to work, I have back pain, you know, and but you know, so there's something going on that you don't, you know, you just don't know, right? But there is a component of cranial work where we call somatic emotional release, and that's in Upledger's terms is a therapeutic process that uses and expands on the principles of CranioSacral therapy, and it's to help rid the mind and body of residual effects of trauma, right? So a lot of the times that I could just be listening, I could have my hands on a person kind of doing a release, but I'm kind of listening to the tissues. That's what we call listening, just kind of, and then, but also I'm allowing them to talk. And so there is a way where if something is significant to that person on the table and my hands are on them, when the rhythm stops, that is significant to them. And so what I'll do, and it's called therapeutic dialoguing, is that I would have them continue talking about what they're talking and to kind of cue them. And then if the rhythm comes back on, that means that we strayed off whatever is significant. So so what they call that is their body is bringing something that's unconscious to their consciousness. And so the body is telling me that. And so I kind of reel them in, you know, and try to dissect that. And if there's something that's very traumatic that comes up, that's something that I may refer to them and say, hey, do you have a therapist? You know, and they say, yeah, I do, you know, so at least I know, because that's not my role, right, as a therapist, but it does kind of overlap in terms of, because I'm doing kind of body work. I'm tuning into their body to kind of know what's going on. And I know there's a lot of research now in terms of how our body stores emotions, right? And kind of like whenever you have trauma, we can kind of hold that. Each cell has memory. And so but we may not consciously remember that, but our body does. So, so I'll give you an example. Say, for example, if I'm treating someone, they have shoulder pain, like they have frozen shoulder for some reason, right? They have like frozen shoulder, we don't know. So I'm working on the shoulder and I'm working cranially, like I'm maybe around their shoulder, thorax, and then all of a sudden their body, they remember, oh, I remember I was in a car accident. I said, oh, really? You know, so we start to remember, and then the seatbelt was right across the shoulder. And so once they start remembering that, what happens is that, oh, I got more motion now. Because they realized it's kind of like they expelled that memory. So it's very interesting.
It does.
It's very fascinating.
Sounds very interesting.
I mean, I mean, the body is, and so the paradigm is the body has its own inner wisdom, but and it knows how to heal and what it needs, but we just have to listen to our bodies. And a lot of times we're just in our heads and we beat our bodies down, and that's where we have to kind of step back and we say, be nice to your body. You only have one of them,
Yeah.
Yeah.
That's all. Like, it's like yoga, same thing, same way. Like the fight or flight, leave the parasympathetic. You're saying just to kind of just let go of things. And
Yes. Yeah.
I just started meditating too, and I started meditating, and that's the same thing. It's just a great way just to let things not let things go. Like that's so simple, but like just
it's almost allowing that memory or emotion to expel, right? To recognize it, but you don't need to have it, not control you, but you don't, you can let it go.
So sorry, Fred. Oh, sorry.
But
sorry.
and so PT, I mean, I really love, I think some people ask me, how do I balance that? What's the difference between traditional PT and then CranioSacral Therapy? Right. And how do I juggle that? And the difference. And I feel that a lot of times when I went to PT school many, many moons ago, we work with, you get a prescription and it says left shoulder pain. So we have to work on the left shoulder, and then we're kind of bound down by insurances where they're saying, okay, if I'm working on the right hip, they're not gonna, so it's almost like it's a body part. We're treating a body part. But I think nowadays, and I think it has expanded, that we really need to work. It's everything's connected, right? And so one thing, a key component, the difference with physical therapy and cranial work is that physical therapy was very left brain minded, and then craniosacral therapy is very right brain, because we have to trust what our hands feel,
right?
And it's very light touch. So, and it can be very subtle. So then you can start second guessing yourself a lot of times, And another difference is physical therapy. A lot of the techniques are very direct techniques. If we're doing joint mobilizations, we're really getting in, we're doing something to the body. And with craniosacral therapy, it's more indirect. We're not doing anything to the body. We're facilitating release. So it's a little different, like we're following the tissues. Right. So that's what we call an indirect technique. Yeah. So it's really a lot of trusting in, my hands and what I feel. And but the more I learn about this and a lot of other osteopathic methods, the body is such an amazing thing.
It is.
Give
it a chance. So where can people are, I'm sure people are, because I know I am, but immersed in this necessarily Upledger, but probably the Upledger and craniosacral work. I was thinking that I want to tweet out or release those links, those videos of the Evaluative Foundation. But if I do it now, people won't. Like right now, this podcast is on next Tuesday, so it would be a week before. People be like, "What are these links?" They don't have heard this podcast before. So I guess maybe once you're listening to this podcast, I will tweet out, and I will include in the description of this podcast the videos from the Evaluative Foundation and the article commentary by Dr. Eric Liskowitz. And that was right. But can you say any sites or any links, anything that you can say to promote, say, to show where people, if people want to know more about CranioSacral Therapy or the Upledger Institute, where can they find that stuff?
Yeah, I mean, really, to go to the Upledger site is upledger.com, upledger.com, and they have a slew of information. And if you search in concussion, they'll bring you to that site where they did the concussion study, and they have a lot of articles and resources and that you can look up about craniosacral therapy. Yeah, so that would be the best place.
Excellent.
To, yeah.
Great. And to concussion and Mount Sinai, for you and Corey Lewis and you and others, your the Mount Sinai concussion. Do you have a web page? No. So where can people find out more about the outpatient rehab or the concussion program at Mount Sinai?
Yes. And, they can email me at tracy.lin@mountsinai.org if they have any questions about the concussion or even craniosacral therapy, and or even on my webpage too, if they have, I have some information there about.
What is your webpage? Is just like from your staff? Just the Mount Sinai physiotherapist, Tracy Lin, LIN.
Yeah, and you can do Tracy Lin PT at gmail.com. It's my email, but I can and my webpage is www.iahp.com and then /Tracy Lin PT. And I can email you.
Yes, I did. That's iahp.com /Tracy Lin.
Yeah.
But I'll include that also in the description, Tracy's website and also her email. And as Corey said last week, it's email Corey Lewis, and Corey Lewis, I don't want to say his name, but it's not because his email actually is wrong, but I have things with one in there. For me, that's interesting. Corey Lewis.
Yeah, I think it's Corey.Lewis.
Oh, God, that's something. See, that was me. And anyway, well, I will include that in both Tracy's email and her website in the description, and also Upledger's website. And if there are any questions about concussions or craniosacral work, email Tracy. And if you have any questions about concussions, I can email Corey or Tracy, or do you have a website on Sinai for concussions, for the concussion program, or is it still in the works? Or
I think it's still in the works.
Potentially.
Yeah.
Okay.
Yeah, I think still in the works.
This was, I learned so much about CranioSacral. I'm still a bit I know exactly, but I still want to learn more about it. So thank you so much, Tracy, for taking the time to explain to me and everyone else listening what is craniosacral therapy and why it's so beneficial to people with brain injury or concussion.
Yeah, you're welcome. Well, thank you for having me and allowing me to explain to you what it is. Yeah, so it's great. Everyone should need a little bit of cranial work now and again.
All right.
Balance us. All right. Thank you very much.
Thank you. Music at the beginning of this podcast is by Ben Sound, www.bensound.com.